Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Westchester County Coronavirus Update for Monday, December 7th. I'm happy to be here with our guest, Mayor Tom Roach, who's going to be at the podium in a few minutes to talk a little bit about what they're doing here in the city of White Plains, one of our largest cities in the county, to deal with the coronavirus outbreak. As we always do with these twice-weekly updates, we'll start out with numbers. The numbers continue to be not good. Every day we're testing and we're seeing a higher incidence of coronavirus infections, and we're seeing an increase in hospitalizations. And sadly, we're seeing an increase in fatalities as well. To the numbers, the most recent tracker information we have from New York State was that which was issued yesterday, Sunday, December 6th. It indicated that there were year-to-date 54,671 people that had contracted coronavirus in Westchester County, and as of yesterday, 46,841 of them had gone through the two-week incubation period. That leaves active cases 7,830 active cases of coronavirus. Generally speaking, those are the people who have been identified, tested positive coronavirus in the last 2 weeks. 7,830 individuals. That's a huge number. It compares the prior week, November 29th, from active cases, which are this week, 7,830. A week ago, they were 5,764. If we go back 2 weeks before that, November 22nd, there were 4,662 cases. And if we go back 3 weeks ago, which was the middle of the month of November, 3,400 cases. We have more than doubled the number of active cases in the last 3 weeks. The 7,830 number, in terms of the number of active cases, takes us back to the end of April in terms of the number of active cases. And that is really a striking note, because we've often talked about how the peak of the infection was in late March and early April. By the end of April, the numbers had started to come down, and it was on about April, my numbers here, April 28th, that we had a similar number in 8,000 active cases, which is what we're just shy of right now. So we have returned to a period of time similar to where we were in the early spring. And so I think we can safely say we are in our second peak of the disease, without question. That we have 7,830 active cases is a significant number of people who have tested positive for coronavirus right now, who have not yet cleared the two-week protocol. We have over 300 people hospitalized for coronavirus. That number is a significant number. It does not approach the maximum number of available beds that we have, but as a number of people who are hospitalized, we then have to go back again to a period of time when we had a similar number of people hospitalized, significant numbers. During the summer, just to give you a representative example, on some nights in July, we had 51, 47, 50, 45 people hospitalized for coronavirus. We now have over 300 right now hospitalized. So clearly, that curve has started to rise significantly again. It mirrors what we had in the early part of the year. The number of hospitalizations has not mirrored exactly the same amount of active cases. We have less people hospitalized now on the number of active cases than we had in the spring. So that is good news. And in terms of fatalities, we have, the last check, 1,529 fatalities. That is 15 more than we had a week before that, and 29 the week before that. So we're now roughly averaging about 2 fatalities a night on coronavirus. We had many nights where we had zeros during the summertime, but once again, the comparison now is where we are here as we enter into the winter. The numbers have increased. And of course, with the winter weather, we have less outdoor dining, we have less outdoor activities and functions, more things are going indoors where the virus can spread more easily. We have major societal holidays and Thanksgiving, which is almost 2 weeks past. Christmas, which is yet a few weeks ahead of us, a little less than 2 weeks ahead of us, a little more than 2 weeks ahead of us. And in those kinds of gatherings, people come together in social settings, in family settings, not in community settings. We've basically eliminated most areas of general societal activity. From the summertime when we canceled summer concerts and we had different types of high school graduations, all the parades have disappeared. Most of the organizations that would normally meet on Zoom or WebEx or some virtual platform rather than in person. So all of those things that we do as a civic society that are under the control of civil government have been stopped. But the virus still spreads. And so we now have to think that that what's happening is really a function of our human interactions outside of public settings, in private settings, in settings where we are with close friends and family, and that is representing the infection spread. Governor Cuomo was on TV this morning. He gave his update in the 11 o'clock hour, 11:30, I believe. He had Dr. Anthony Fauci on board to chat with him about some things. Some of the things he pointed out, and I do want to share those, and they're important because the governor has executive authority that overrides those of us in local governments. Mayor White Plains is here, Mayor of Yonkers, Mayor of New Rochelle, Mayor of Mount Vernon, all important, powerful positions, County Executive, Westchester County. And we have executive authority under normal circumstances, but the governor's executive authority overrides ours. And, of course, he did that very early on in the process, so there'd be a singular approach to decision making and not by community or even by county or by the city of New York. So the things that he talks about in his updates become very important for us. Right now, as we're speaking, there was a rally in Portchester today protesting the decision for orange zone status. We'll talk about zones again in a second in Portchester. But that decision is not a village mayor decision. It's not a county executive decision. It is the governor who makes the decision based on the data that he has available to him on a countywide basis. So his comments today include some of the following things. And I think his emphasis now is looking more at hospitalization and what happens if the hospital system is overtaxed with people who have COVID, they've tested positive, and now become ill to the point at which they have to be hospitalized. And when do we reach a point of great concern where the amount of illness may override the amount of capacity that we have to deal with it? His comments today, he's directed all hospitals, which are regulated by the state of New York, to increase their capacity, their bed capacity, by 25%. And he's called for retired nurses and doctors to return to service for their assistance during this spike. We did a similar thing with nurses and doctors earlier in the year. We got a great response. Well over 100 medical professionals came to the fore, and it helped us get through that first peak that we had here in Westchester County. His call is statewide for doctors and nurses who may be retired or out of the business, so to speak, to be involved with. The governor particularly highlighted the issue of small gatherings and indicated the public needs to cooperate, keeping down the number of those participating in family gatherings through the holidays to help curtail spread. I've talked before about how difficult to impossible it is to police personal behavior in your private home. We're certainly not going to have county police, and I'm sure it's true in the municipalities as well, try to identify that. But we do appeal to people's common sense that this virus is spreading, and people do get ill and they do die, and that possibility of spread, if there's no or minimal public interaction in these things, then it falls to the private interactions where people are having a few friends over, they're meeting with pals, they take the masks off, maybe they're eating at the time they take masks off, but whatever it is, the virus is being spread in some continued capacity. He's concerned, as we all are, about the fact that the holiday season and our traditions represent a coming together. We're entering Hanukkah very shortly, and then after that, Christmas follows closely after that, and then that's followed by New Year's, which is normally a big night of celebration. Tom Roach has the greatest party in Westchester County every year for New Year's when they drop a ball here in White Plains. Why go to Times Square and you go to White Plains? But that's not going to happen this year, just like we all canceled our fireworks because we know that the enjoyment of a night like that is to have people close together. And that's exactly what you can't have in a civic functioning. So he'll talk a little bit about that, perhaps if there's a virtual ball drop or whatever's being planned in White Plains. But those holidays ahead of us, following Thanksgiving, are concerns that the governor highlighted. And he said that if we overwhelm our hospitals, many people are going to end up in hospital hallways. They're going to be on a gurney, and they could die on a gurney waiting to get access to a bed, access to a ventilator, access to the professional assistance that they need. So he identified that the key metric for the state to decide on further restrictions will be critical hospital capacity gauged over a 7-day average hospitalization rate. Now, if we look at any 7-day period in Westchester County alone, we see a steady rise. And when you do an average, usually the average will be a little bit less than whatever the peak night is, because the peak night is your most recent night if it's 7 days of increase. But then the next day, there's a new peak night, and that moves the average up over the prior 7 days. And right now, I would eyeball it that we are somewhere over a 7-day average north of 250, even though we have 300 plus people who are hospitalized now. And when we have numbers that come out over the weekend, those numbers may ratchet up even further. If a hospital in given region are expected to hit a 90% capacity level within 3 weeks, that's the rate of increase of hospitalizations, then that area will be put on pause. Pause is a nice word. That means shutdown. And in what way, shape, or form those shutdowns occur, he will make those decisions. When we were in the spring, you'll recall that essential businesses, non-essential businesses were closed, and that included a host of different types of activities, clearly restaurants, gyms, and barbershops, and a host of places. And then he had a phase program where we started to reopen the society in consecutive periods of time. We go 2 weeks, phase 1, 2 weeks, phase 2, and so forth. All of that reverses if the hospitalization rate starts to hit a 90% capacity level. Now, in our hospitals right now, we have lots of people, not just COVID patients, and they're there for lots of reasons. Person has a heart attack, they're in the hospital. Person is getting a new hip or a new knee, they're in the hospital. But the degree to which urgent use of the hospital bed and the medical professionals now becomes focused on COVID, and so what's considered elective surgery is postponed. And it depends on how the doctor judges the necessity of the patient for a particular service or a particular operation. But things that are considered not essential will be postponed in order to free up hospital beds to deal with COVID patients as these COVID number rises. And I must say that here in White Plains, we have, for quite a while now, almost a year, turned over the Westchester County Center to the state for operation as a field hospital. There are, and have been now for quite a number of months, 110 potential bedrooms. And this is not pipe and drape and a cot. This is hard wall rooms that have been created on the floor of the county center, where I last saw basketball for Section 1 in early March. And then also in those tents that you see out in the parking lot as you drive down Route 119 or you drive north of the Bronx or south of the Bronx River Parkway, you'll see tents outside. 54 units outside, 56 units inside, 110 backup units to add to the inventory of hospital beds. Any number of people have asked me over the course of time, have you had any people in those bedrooms yet? No, is the answer. Well, why don't you put them back to other use? Because there was a concern that a second wave would come. Well, the second wave is here. Now we're going to see if we're going to need to use those rooms. And keep in mind, I say this every time we talk about geography, we may have enough bed capacity in Westchester County to handle Westchester alone, but we do not have a moat around Westchester County. If there are insufficient beds for our neighbors in Rockland and they have cases that exceed the hospital capacity of Rockland, then we are certainly going to house them in Westchester. And we're going to do the same for Dutchess and Orange and Putnam, for friends in Fairfield County if the Fairfield County hospital system reaches a point of override, or for the Bronx. And all of those factors will come into play when we determine whether or not those places are used. We have in Westchester County a number of hospitals, and I'll mention some of them, which I'm sure you're familiar with them around the county. The Montefiore system has 2 hospitals in Westchester directly, Montefiore Mount Vernon, hospital I was born in, Montefiore New Rochelle Hospital. In New York Presbyterian system has a New York Presbyterian Lawrence Hospital in Bronxville, and the Hudson Valley Hospital up in the northern part of the county in Peekskill. They also have a connection here in White Plains. The Northwell system has Northern Westchester Hospital in Mount Kisco, and Northwell also has the connection with Phelps Hospital located in Sleepy Hollow. We have St. John's Riverside Hospital in Yonkers, with St. John's Division in Yonkers, the Dobbs Ferry Pavilion, which once was, I think, the Dobbs Ferry Hospital, the St. Joseph's Medical Center in Yonkers, Westchester Medical Center, which is the largest of the group all in Grasslands, was once a county hospital but is not now. And then, of course, the White Plains Hospital Center, which does have an affiliation as well with Monty. And they're run very ably here in the city of White Plains. And to give you an idea of capacities, the Westchester Medical Center has over 700 beds. They are the largest hospital in the county. In the 250 to 300 range are some of the larger hospitals we have, like Northern Westchester and Mount Kisco, White Plains Hospital, Lawrence Hospital in Bronxville, all run in the 250 to 300 range. Slightly below 200, Phelps Hospital, St. John's Division in Yonkers, and then you have hospitals with smaller capacities, and the Mount Vernon Hospital, which has been ratcheted down dramatically from what its capacity is listed as under 100 units, and the Dobbs Ferry Pavilion for St. John's is a very small capacity. So the governor has tasked these institutions and all across the state with increasing their capacity by 25%. There may be more than that that's possible, depending on the physical construct. We have had hospitals closed in this area. St. Agnes Hospital of Memory now has become an assisted living facility. United Hospital is not usable in Port Chester. The building is no longer habitable. for a hospital or any other kind of purpose, it'll ultimately have to be taken down, demolished, and that is part of what we have to try to observe and manage if we want to stay on the correct side of things. When we look at the different communities that we have in Westchester County, we are still working on a series of priority zones that were created by the governor about 3 or 4 weeks ago. And in Westchester County right now, there are 6 zones that have been established. The orange zone is the intermediate zone. The red zone, the most severe zone, has not yet been applied to any place in Westchester County. The orange zone, there's one community, the village of Portchester, that has orange zone designation. And then there are yellow zones in part of the city of New Rochelle, part of the city of Yonkers, in the village and part of the town of Ossining. In the adjacent villages of Tarrytown and Sleepy Hollow, that's one zone, and in part of the city of Peekskill. And those yellow zones are the precautionary initial level of zones. We are awaiting the governor to make decisions, perhaps later this week, that may add to the number of zones or increase the severity of the zones by bringing, yellow to orange, orange to red. When we're finished in a few minutes, I'm going to go over what some of those prescriptions are again. The protests that you see today in Portchester represent the community that has the greatest amount of restrictions because of orange zone presence. And orange zone presence, as we'll talk about, as I said, affects restaurants, it affects non-essential businesses, and of course we're in a societal push and pull between what represents the right decisions to make in terms of health, but how do those decisions affect the economics of individuals, business people, and individual consumers, people who are working for various businesses. And if the business can't function and people get laid off and there's a loss of revenue and profit for the business owner, they push back and they look at other areas, why are we here and you're there, and all of those kinds of decisions. The city of White Plains, which is home to the county government, it's where I come to work every day. I've represented parts of the city of White Plains in my public career prior to becoming county executive, and I don't know it as well as the next speaker knows it, but I've been in every corner of White Plains at some point or another. White Plains is a significant urban center. You can see it on the highway. The high rise of White Plains is visible on 287. And if you're coming in on an airplane to LaGuardia, much less County Airport, you'll see the spires of White Plains that mark it as a city for which there's been development and energy and excitement. This city had the most active downtown nightlife of any of the municipalities in Westchester County. McLean Avenue in Yonkers will give us a run for the money, but in downtown White Plains, you had a certain amount of that. You have structured outdoor dining in White Plains physically in a more open way than in many other places. And the businesses and the law offices and the county government based here in the heart of White Plains has given it a certain vibrancy. That creates additional problems in running the city of White Plains, which is still a city of neighborhoods and a place where people come to live, not just to work. And Tom Roach has been mayor of the community now for a good number of years. He's done, frankly, an excellent job in managing through this, but nobody expects to manage through a pandemic. When we first talked about it, we were just in the very front stages of this, and Tom and his administration, the people around him, and along with the support of the Common Council, have done a very good job here. And I know because I work here every day, and I see the work that's happening in the community. But nonetheless, I wanted Tom to give you a little update on the city of White Plains, sort of the center location in Westchester County, where we are and what we're trying to do to deal with the COVID virus outbreak. So with no further ado, the mayor of the city of White Plains, the Honorable Tom Roach. Tom?
Thank you, George. And I'd start out by commenting that a lot of times people will ask me, what have you done? What work have you done in response to the pandemic? And we've done a lot of work, but what's more important is what have you done before the crisis came? And I think you just heard from County Executive Latimer, and you see the knowledge he brings to bear and the resources, and just the way our county works together is very collegial, and we're all working well together to make things better for individuals throughout the county. The city of White Plains is a population of just under 60,000. We think when the census comes in, we'll be over 60,000. But during the day, in normal times, we expand greatly, estimated to be about 200,000, with the corporate presence, the restaurants, dining, nightlife, and the rest. That has all pretty much disappeared or been vastly reduced during COVID. We do have a very strong outdoor dining component in our city, which predates the pandemic. So we were well situated when that became the dining of choice. However, as it gets colder and people move inside, we are seeing an uptick in the number of cases. I wouldn't say uptick. I would say we have taken a full step into the second wave in Westchester County and the city of White Plains. And I think people are aware of that. We are in a different position than we were in the beginning. In the beginning, there were a lot of open questions, a lot of things people didn't know. And now I think we're all more experienced. Wearing masks has become second nature. And that is probably the most vital thing you can do to mitigate the impact. Today, the governor, when he was speaking, he actually threw out the percentage, 70%, they believe. 70% of the new cases are coming from in-home transmission, from people who are close to each other. And it's understandable. If you've been friends with someone and I have friends that I've been friends with for 40 years, 50, 45 years, and when you see them, it's just naturally you relax. You go to their house. If you went to their house, you'd just sit on the couch and relax. We just have to remember that for the purpose of this pandemic, my friend that I've known for all those years, but I haven't seen in 3 weeks, he's the same as a stranger on the street, and we can't do that. So we're working hard to get that message out. When this started out, I did a robocall, and it was well received. I believe we did 100 days in a row, a robocall every day through the weekend. We then started to dial it back. Right now we're at once a week. We may be expanding that as well. What we try and do is give out information to people, the information that we have, much of it provided by the county, and in a way that hopefully they can understand and make decisions about. We've seen great compliance with mask wearing in White Plains. I walk the city, and it's really tremendous. That does not mean everyone's going to wear a mask, but the compliance has been very strong. I have had a few calls and emails from the people who say that my freedom is being taken away if I have to wear a mask. That has largely dissipated as more and more data, studies, and experience indicate that mask wearing has a tremendous impact on the spread of this virus, a positive one. So where do we go from here? Well, we're doing the same thing. We're pushing out our message, reminding people what they need to do and what they should avoid doing. We hope that everyone will continue to wear their masks as they have been. I know when my son came back from college, the way they were doing it is you test before you leave, and then you test, you allow time to elapse, and then you test when you get back. And in that interim phase, we all wore masks in the house. We all wore masks whenever we left our rooms. We are not in one of the zones right now, but I anticipate we will be eventually. The nature of the housing that we have in parts of our city is where we're seeing a lot of the increase around the county and around the country. And if you are living alone in a studio apartment, you are less likely to contract the disease. But if you share your apartment, I mean, when I was a kid growing up, me and my two brothers slept in the same bedroom. And I remember when one of us got mumps, we all got mumps. And when one of us got chickenpox, we all got chickenpox. And it's just the nature of it. And so we're prepared for that. And I'll just finally note that we are working, I am working on a vaccine committee. We're working with White Plains Hospital and medical professionals to craft a message regarding vaccines. There's a lot of bad information out there. We want to get the good information put together, and we want to make sure it gets into people's hands. We're also going to be bringing in many members of the community into this committee because we want the information to be presented by trusted and credible members of our community to ensure that when the vaccine is available, that everyone will have an opportunity, people will take advantage of it, because we think that's going to be the game changer, and we all agree on that. It's December 7th, so I just want to throw out, this is when the day of infamy, when our Navy was attacked in Hawaii. And if you think back to that time, people didn't know when it would end, the war, how it would end, and they got to work to try and make sure that everything went the right way. We're in a situation right now, we know this will end, and we pretty much know when it will end, and it's a few months away. So we're just asking everybody to just buckle down for the next few months, stick with it, keep wearing your mask, be careful, so that we all get through onto the other side of this. We know it's going to end, and it's going to end favorably. We got to do what we can in between now and then to minimize the damage. So thank you, George, for having me today, and with that.
Thank you, sir. Thanks very much. Again, that was Mayor Tom Roach from the city of White Plains. We're very happy to have him here, happy as a friend and also as a colleague in government. And as Tom said, we're working very closely with all of the municipal governments, the towns, the villages, and the cities of Westchester County, and we're working collegially, the county being a local government of just a different size and scope than the cities, the towns, and the villages. Every Monday afternoon at 3:30, we have a municipal call where all of the representatives are on board. We also invite the county legislators and the state legislators, state senators, and the state assembly members to join in, ask questions, report on whatever information is most relevant at the time. We'll do that again today at 3:30, and we'll continue that on Mondays going forward. We will, as we have in the past, we've been doing this now for 9 months, as we start to ramp up our reporting to, we will invite other colleagues of Tom's and other municipalities to join us here, mayors and town supervisors as well, to report on what's happening in their community. We think it's important because Westchester County is not any one community. It's a fairly large county by general standards, and people who live in one corner of the county may not have an idea of what's happening in another part of the county, but the statistics we report cover the whole county, so you should have some idea of what's happening. And certainly White Plains, because it is the governmental capital of the county and it's got sort of the concentration of shopping and businesses, really has a very special place in everybody's mind. So again, Tom, thank you for your leadership, and thank you for being with us here today. I want to mention just one more time through about the various zones that we've talked about. The governor has not made any changes to the zones in Westchester County. As I mentioned previously, there's an orange zone designation for Portchester, and then there's 5 communities that have yellow zone designation. There's also a yellow zone corona that exists around the orange zone of Portchester. So there's parts of the village of Rybrook and a small portion of the city of Rye that also fall into yellow zone capacity. The yellow zone designation is the lesser of the 3 categories of zones. It involves maintaining all businesses being open under yellow zone designation. The impact on dining, indoor and outdoor dining, is permitted under the yellow zone, but there is a maximum per table of 4 people per table. So if you're in White Plains, which is not under any zone designation, if you're in the city of Mount Vernon, which is not under any zone designation, or the village of Larchmont, or you name the communities that aren't under zones, there are no restrictions, that fit as tight as the yellow zone does. Yellow zone starts to restrict, orange more so, red more so. You go from restriction to prohibition. There's a restriction of maximum capacity in houses of worship, churches, synagogues, mosques, other venues of worship, 50% of maximum capacity under yellow zone designation, and then maximums of non-residential gatherings, primarily indoor and outdoor, 25 people under the yellow zone. Right now, in general, it's 50. So if you had some type of a meeting properly spaced in a room, social distancing, you could have 50 people in a room in a community that is not in zone, any color zone. If they're in yellow, that number drops to 25. And in residential gatherings, 10 people maximum, indoor and outdoor. Those are certainly the toughest ones to monitor. And then there's school testing that goes on for schools. We also have a Monday's call with the various school superintendents right now, and many of the schools are in various statuses. Some are totally remote, some are hybrid, with some kids going in on certain days, not other days. And there may be a few out there that are fully engaged with in-class learning. But even with that, it's socially distanced. It's not the full capacity. There are plexiglass shields and a host of different other restrictions. When the yellow zone goes to orange zone, this is again what Portchester is facing, and maybe some other communities once the governor takes a look at it, the restrictions get tighter. Originally, the schools were supposed to be closed under orange zone capacity, but now he's established a different standard. 10% of the population of students and staff must be tested in a 15-day period. In the second 15-day period, and an additional 10% cohort must be tested. And then, of course, the testing have to show that you have positive ratios at a certain level or below, otherwise the district would be closed. Those numbers jump up if you go into red zone category, 15% in each half interval of the month. And, I would think what the governor and his key people are trying to do is figure out how to maintain some semblance of a normal academic year so we don't lose the whole academic year, which is possible depending on what happens going forward. Many parents who work want their kids to be in school because they can't handle them properly at home. Many educators tell us that if the children are home, they're just not getting the best educational experience as they would if they have at least some in classroom settings. On the other hand, we're completely concerned about the spread of the disease, and the more people that are in a congregate setting, the more likely it is that the disease will circulate. So we're dealing again with the two balancing points of these things, not easy to do at all. On the dining side, when you get to orange zone, indoor dining is ended. No indoor dining, you must do outdoor dining. And outdoor dining at this time of the year now is not much of an easy option. And there's been some debate over whether or not some of these outside tents that have been created at great expense by many of the restaurateurs actually suffice as outdoor dining. If you close the flaps because it's windy and cold, you create an indoor setting outdoors. And so that debate is going on right now. Our county health department takes its instructions from the state health department, and that is the basis upon we make the decisions as to whether or not a particular setup satisfies under orange zone or not. There are certain high-risk businesses that are deemed not essential in orange zone capacity. Gyms, fitness centers, barbershops, hair salons, personal care services, tattoo parlors, things like that are closed under orange zone restrictions. It's another reason why you look and you see the circumstances in Portchester as it may exist. And then we're also dealing with a lesser capacity in the houses of worship and the other gatherings. No part of Westchester has yet been designated in a red zone. We hope we can avoid that. It prohibits a number of things. All non-essential businesses now are closed under red zone capacity. There's only takeout dining under red zone and continues on with greater restrictions. We are suffering without question a degree of pandemic fatigue from having gone now 9 months with a lockdown of the society in some way, shape, or form. The economic impact, as we all know, and I stated previously, is significant. And we've tried with resources to help through our Director of Economic Development, Bridget Gibbons, with different grants and programs and things like that. But generally speaking, businesses would prefer to be open, and particularly in the month of December, which is the busiest shopping month of the year. This is the month where holiday shopping reaches its peak. It matters to the businesses. They make a lot of money in this month, which they need to tide them through the soft first quarter that usually follows the heart of the winter. And then it's also something where our governments rely on sales tax. Why City of White Plains, County of Westchester have a heavy reliance on sales tax as a revenue stream. And if the purchasing drops off at this time of the year, our budgets are affected by it. And it comes right at the end of the county's fiscal year. White Plains is in a little bit different situation, but all of our towns and 4 of our 6 cities are on calendar year fiscal years. And right at the very end of the year, if you don't achieve your sales tax revenue, you have no other place to go to make it up. There's no other alternative time frame, revenue. You could do a bit better in something else. The year ends with a drop-off if that's what happens out there. So we will await to see if the governor has any other plans on these zones. We try to work with the governor's staff to help shape if a zone designation is going to happen, try to shape it around the geography where it matters most and not by happenstance to include more than what is essential and necessary for the zone to work. We hope that we can justify not having any zones. We hope we can justify that the areas that have zones will have them reduced or eliminated, but that will be based on numbers, much of which we don't control. When the county gets involved in these things, we put our county health department at the disposal of the local government to try to help them work through this, how we enforce the regs, how we deliver PPE and masks to targeted populations, and hand sanitizer, what we do to help craft a public information message using some of our staff and some of our resources and customize it to each of the communities is what we're going to be doing. Where we have 6 zones right now, that's one thing. If the whole county finds itself in a zone, then our resources are taxed pretty dramatically. And that would be true also of contact tracing, which is the system of detective work that goes behind every person who's been tested positive. In theory, if I test positive, the contact tracer wants to know who have I come in contact with over the course of a period of time. Well, I just saw the mayor of White Plains. We have to know if I'm positive, and then he has to know whether he's positive or not from whatever I did with him, because he's going to go out and see a host of people over the course of the next week and everybody else that I've had contact with. So contact tracing is an essential part of the public health process. But I must tell you, when you get 750 positives a day and the next day 750, and every one of those 750 has to be called and identified, the 20 people they each saw, and then every one of those people have to be called, we have a massive task in order to do contact tracing for these kinds of numbers. And it is very difficult to ensure that we're hitting those marks effectively across the board. I also want to mention one more thing relative to COVID, that's the vaccine situation. We do not yet have, from the federal government of the state of New York, a game plan for the distribution of vaccines. You have followed the same information that I have seen, in which certainly healthcare professionals are going to be the first targeted people. The nurses, doctors, respiratory therapists, the people who are on the front lines dealing with the medically ill will be the first ones to get access to the vaccine. The protocol will be worked through at the highest levels in the government, and we will help as a county government implement whatever that strategy is. We'll try to have some input in it in our backyard. We'll use the resources. We have a couple of clinics, one here in White Plains, one in Yonkers. We have the capacity to do things on a mobile basis. We have the capacity to work with the state and the federal government and the companies themselves, the pharmaceutical companies that have developed the vaccines. There is a debate in the society of whether you take the vaccine or not. It's no debate in my mind. If I am entitled to have it at some point in time in the process, I will take it. And I'm not particularly concerned about the side effects. And I will tell you, I grew up in a generation where as a kid, I was vaccinated for whooping cough. I was vaccinated for measles, German measles, chicken pox, polio, you name it. In retrospect, I didn't like any of it to the extent that I remember getting shots. I probably cried like everybody did at that age. But the bottom line is that all of those childhood diseases that devastated another generation of Americans did not decimate the baby boom generation, of which I'm part and parcel of. Those vaccinations worked. And my daughter, during her youth years, were vaccinated as well. We've had no negative incidents with it. Some people have, and so that may shape their thinking of it. But I will tell you, there's a lot of misinformation going on out there on the internet. There are a lot of people who advance theories of varying degrees of accuracy or not. And I think our mindset in this country has been now opened to a devious plot behind every single thing. We lack faith. Everything is fake news if we don't agree with it. And I think we're in a bad place. This vaccine is the light at the end of the tunnel. If you reject the vaccine, what path gets you out of this? Unless you believe it's a hoax, and we've got 1,500 dead people in Westchester County that prove it's not a hoax. So as last week when we had our ceremony of the Ribbons of Remembrance, we've lost friends and neighbors to this disease. If this vaccine is the path out for us, broad-based vaccination, knowing that some people will react badly to any injection, some people can't take it. But if we look at this as some sort of a conspiracy, a fake, and I'm not going to take it and you're not going to take it, then there is no other path out of this. We continue to wear masks. We continue to have people be infected and die from it. We continue to spread the disease because many of the people that won't take the vaccine won't wear the mask. They won't do anything with it. Their attitude is just, I'm going to ignore that this is the crisis that it is. And I think we will pay a bitter price if we continue on this path that we're on. But, I'm not here to nag people. I'm just here to call it the way it is. We will see what happens when we get to a vaccine distribution structure, and the county will be involved in it. And I think all prudent people will take it, and those that don't take it, unless they have a personal physical reason not to take it, will be taking a risk that's unnecessary. And unfortunately, it won't just be their risk. It'll be a societal risk for those who choose not to take the vaccine and therefore expose themselves to the disease and make it more possible for them to spread the disease to other people. Non-COVID related things, we want to mention that we have announced that Playland parking lot is now closed for the winter season. This past weekend it was open. We've had Playland serve as a staging area for various rallies of various sorts. We believe in free speech. We believe in free assembly. We don't have to agree with the speech or the assembly, but we grant that that is a constitutionally protected right. But it is also important for us to close the park so that we can start the process of doing a variety of projects that have to be done down there. We have a switchgear building, which I'm sure you're not that interested in, but it's a power source building that has to be constructed in the parking lot, and it will take time and effort to stage and set that up before construction, so we're not in a position to maintain that parking lot as open. It will have the added benefit of stopping the drag racers who come there in the middle of the night to shoot up and down the big, large parking lot areas. They're going to have to change the behavior on that. But I want to make it very clear, Playland parking lot is closed for the season. We're going to keep a small portion of spaces available for people that want to go to the boardwalk or go to the beach. Dogs are allowed on the beach in the off-season, so if you want to come and walk your dog legally, you can do that at Playland. And there will be a separate parking area in a further remote portion of it for people that want to go to the Reed Sanctuary and walk through the nature preserve. That's sitting at the northeast corner of the Playland parking area, the Playland footprint. But any large gatherings of people at Playland will no longer be accessible there. We'll keep it closed until the springtime as we get ready for what we hope will be the opening of Playland God willing, that we're past the point in this pandemic that we can do that. So Playland parking lot will be closed for the winter. Get the word out so people don't show up there expecting it to be open. It will not be open. It will be closed to the public. We have opened Kensico Dam Plaza for Winter Wonderland, and it's a different type of event this year. We thank the Westchester Parks Foundation and other generous donors that make this happen. It's really a lovely wintertime activity. It is not park your car, get out and walk around now. It is a drive-through event, so throw the kids in the back of the car. You pay one price per car, $25, rather than per kid, so this is going to be a little less expensive than it has been in the past years. You'll see some beautiful lights set up and some interesting things that'll keep the kids interested, and you'll be interested too. And we've sold over 20,000 tickets so far, so our expectations when we take something that was an in-person event and we turn it into a drive-through event, we're wondering what the acceptance is. We're doing very well, and we're very happy to have that. Winter Wonderland is open Tuesday nights through Tuesday days through Sunday. They're closed on Mondays, and if you'd like more information, you can go online and check the westchestergov.com, look for recreation. You'll find the information there. It is also closed Christmas Eve and Christmas Day, and it's open until January 3rd. Golf courses are still open also through January 3rd. It's a little hardy golf out there now in this temperature, but a true golfer is committed to playing no matter what the conditions are, so the courses remain open, all 6 public courses. We have had a record year for golf. If you only looked at golf statistics to try to judge how 2020 was, greatest year we ever had in the county because they've had over 70,000 rounds of golf. It has been a safe, socially distanced recreation, and it's been embraced by those people who love golf, and they love it as a way for them to enjoy the great outdoors. Our parks are still open for walking and the Bronx River Parkway path, North County Trailway, South County Trailway, bicycling, and golf also turns out to be one of those kind of sports as well. The Holiday on the Hill Train Show, Lasden Park and the Conservatory, continues on through December 31st. There's an admission price of $20 per adult, $10 for children, $15 for seniors, near and dear to my heart. And you can go see a really lovely train show at Lasden. It's socially distanced. Mask wearing is essential, but you'll be able to enjoy that. So we still have some of the parks things that are open here within the county. And I do want to mention, I'll close with this, that the Westchester County budget is still under review by the Westchester County Board of Legislators. This being the 7th of December, they expect to meet a week from today to take final action on the budget. It's against a calendar year, fiscal year, so everything has to be in place by December 31st. We've submitted a budget, as I've indicated before, that cuts total spending, cuts property taxes by $1 million, also has the benefit of maintaining most of the important services that we have. You can look online, westchestergov.com, if you want to have a budgetary review and discussion. We'll discuss that issue in a different forum. But the Board of Legislators does have a public hearing, a WebEx event, coming up Wednesday, December 9th at 7 p.m. That's this coming Wednesday. If you want to speak or submit comments, you can contact online. There is a special number I would suggest that you call the Westchester County Board of Legislators, 995-2800. Get all of the details. When you have to register to the board, clerk of the board to be heard and what numbers, special numbers you have as speakers. But this is your opportunity, your second opportunity to comment on the county budget directly to the Board of Legislators, who will be finalizing the budget that we've submitted to them. They'll return it to us. We believe on the 14th, and then we'll take some action. We have executive authority for line item veto, overall veto, but we think we can work this thing and get a budget done, put it behind us, and then focus on the issues at hand. So we're going to go to Catherine Chaffee for any remote questions that we have from members of the press. We'll take the questions we have here now. Obviously, any questions for Mayor Roach, I'll invite him back up to the podium to address any White Plains-specific questions. Catherine, what questions do we have?
So we have a few questions from Pauline, who's the Assistant News Director at News 12 Westchester. The first one is, Governor Cuomo said the state is prepared to order more hospital bed capacity and possibly ask hospitals to cancel elective surgeries to make room. What is the county's plan to prepare for this? Are you prepared to retrofit the county center again as an emergency hospital?
Well, it's already retrofit, Pauline, for that purpose. So we have the capacity for 110 additional beds. What we would have to do as the hospitalization numbers rise and we get to that point where it looks like we're going to exceed the existing capacity in our hospitals is we will then work with the state on how the medical center facilities are going to be staffed. But they are physically built out as it stands now for 110 beds. with ICU capacity if necessary. So we are physically ready for that to serve as a field hospital to complement our existing inventory of hospital beds and so forth. The state governs the authorization of all hospitals, including this field hospital. So it will be the county working with the state to determine how best that's going to happen. And there may be an affiliation with one of the existing hospitals because you need professionals to go in there. You can't just staff it with anybody. And I believe his call for retired doctors and nurses to help complement the system of manpower is essential if we're going to handle a field hospital like the county center. But it is ready to go.
The next question. In the press conference, or during the press conference, Dr. Fauci said 75 to 80% of the public need to get vaccinated to bring the numbers down. 50% is not enough. What kind of education campaign is Westchester County planning?
Well, we're not at the point yet until we know how the vaccine is going to be disseminated. So once the dissemination plan is made apparent to us, then we're going to work on a public campaign. Obviously, we will reach out with general public information as we've done before. We'll use social media, no doubt with videos. We'll have people on board who are qualified representatives of the communities, people who are respected because of their involvement in the clergy or the municipal areas of life to speak on behalf of taking the vaccine. We have to have a discussion ahead about how we want to handle our governmental workforce, and we'll talk with the unions that represent those workforce members and determine how we're going to handle that. We also will, most likely do something public that will show a commitment to these things. As I said a few minutes ago, there is and I consider a surprising percentage of Americans that indicate they're not prepared to take the vaccine. And, it's, a little kid, as when I was, that didn't want to take medicine, didn't want to go to the doctors, didn't want to go to the dentist. And I understand why. I remember not wanting to sit in a dentist chair. I remember not wanting to take, castor oil, whatever it was that had to be done. It was unpleasant at some level of unpleasant. And there's always a fear of how you're going to react to it. So I understand that there are people who don't feel confident. And the question is, what will make them confident? Will make them confident knowing more about what's involved in the science that produced the vaccine? Will that help a person? Will they sit and listen to that kind of information? I heard somebody say to me, I want to know what's in the vaccine before I take it. And I asked him, I said, well, do you know what's in a Pop-Tart before you put it in your toaster and eat it? And he looked at me as if I was being insulting. And I said, no, you ingest, and so do I, things every day that you take on faith. Your fear might be a reasonable concern, but then you have to open yourself to listen to a professional response to your fear. You just can't say, I don't know what's in it, I'm not going to do it, too bad. And as I've indicated before, I think the public education will, to some degree, involve substance to help people bring it over. To some degree, will involve people who have trust, positions of trust in the society, who people are looking and say, well, okay, if this person is doing it, then I feel more comfortable doing it. And I hope that people who give you an initial reaction now will think twice before they make it a final and a firm decision not to take the vaccine.
Okay. And the last question from Pauline. With 170,000 vaccine doses coming to New York State, how many doses are coming to Westchester? And can you explain how the health department is deciding which nursing homes and hospitals will get the first doses?
Well, Pauline, those are really good questions. I think they need to be directed to the governor of the state and to the people who are going to make those decisions in a macro level. The county government will not make those decisions, not within our authority. We'll be happy to work with the state as they determine what the plan looks like, and then we working through the various hospitals. I suspect that given the fact that the governor has tasked people like Michael Dowling from the Northwell Association of Hospitals, or Kenneth Rasky, who is a Westchester resident, head of Greater New York Hospital Association, he's, I think, expecting to have the dissemination of the vaccine go through medical institutions, and they may involve consortiums of doctors, the West Meds and the ENT and allergy type organizations, and that may be how the vaccines are going to be distributed. To the extent that the county or the city or any other government has input in how it should be, I can certainly opine, and we'll certainly put county resources behind it, but it will not be the county health department making the decision of who gets the vaccine and where is it going to be disseminated. And the first round of 170 units of the vaccine, I think, is pretty clearly going to start with healthcare professionals. And I don't know how many there are that will be vaccinated, but I suspect, 170,000 seems like a large number, but we've tested over 1,000,001 people here in Westchester County alone for the virus. So 170,000 units of anything will go pretty quickly statewide. I think we need to see the macro picture. And one more point of candor. I mean, we're within 40 days of a new federal administration. And I think whatever decisions are made now may or may not be, colored by a new administration coming in, which has indicated they really want to make an aggressive effort to go after the COVID issue and not sort of, play it a little bit differently. So we'll see.
The next two questions are from David Proper from the Journal News. Yep. The first, can you tell us the exact number of hospitalizations and as of what day that number is from?
Well, we have to check a report, David, that we get every day, which I have not had the opportunity to check at this point. The last number that I saw was last Wednesday, 292 hospitalizations. They've been growing in the vicinity of 15 to 20 hospitalizations a day. And for a news report that you'll put in the newspaper, most likely tomorrow, put online later today, after this is over, contact Catherine Chiver. Give us about a half an hour to work with, and we should be able to give you an updated number that will probably take us, if this is Monday, probably take us through Saturday. There's usually a 2-day lag on getting this information. The hospitals do not report directly to us. We have to get this information from their reports to the state government and then download them and add them up to get to the right number, double check our numbers before we go public with it. My guess is that we're somewhere in the low 300 range, but the hard last number I have is 292 on Wednesday of last week.
Okay. And the last question is, how fair is it to compare the current situation to the spring, when the testing is significantly higher this time and more cases can be identified?
Well, I think you make a comparison, and then you draw what's alike and then what's different. There's nothing wrong with the intrinsic comparison. I think, as I've indicated, that when you have a certain number of active cases today, it tracks to where we were with active cases in late April. But when we talked about hospitalizations, the hospitalization number is down, so our current hospitalization number is more analogous to where we were in June, let's say. That is a sign that less people have been hospitalized based off the same number of active cases. I think you're not looking to draw a straight line comparison that what we had in the spring is exactly what we have now. It is not. Not being a medical scientist, I don't know when I look at those numbers if there is some objective reason for it. Is the strain that we're experiencing now less severe? I don't know. Is it because in the hospital there are protocols that the doctors are following that make it easier for them to keep a patient stabilized and therefore their antibodies fight off the disease? I don't know. The fact that we wear more masks in the society now than we did in the spring, I think, is a factor. But, we have a lot of positives because we test a lot of people, but the infection rate itself has risen. So it really isn't a matter of the volume of number of tests if the actual percentage of people have risen along with the absolute number of tests. If somebody said, well, you have 500 positives now because you're testing a lot more people, you had a higher rate of infection when you were testing only 2,000 people a day. But that's not the case. We have a higher rate of infection now, even with more cases. And what it does probably tell me is that aside from the fact that we have 54,000 people year to date that have been tested positive, and we have 7,000 some odd people now walking around who have tested positive, hopefully they're in isolation, I suspect that means that there is a bigger piece of the iceberg that's under the water that you can't see, that are people that have the disease, are asymptomatic, don't realize they have the disease, didn't know they were exposed, haven't gotten sick enough to register in their minds. They're walking around thinking they're still as good as could be, and they're highly contagious. And that could certainly be a factor as well. So, we're still dealing with a lot of unknowns with this. And certainly I'm not a medical professional. We're trying to make the best possible decisions given what we know.
That was the last question.
No other questions. Very good. Well, thank you very much for tuning in. We will be back on Thursday, I believe, at 2 o'clock to give you an update of where we are at that point in the week. We may have some more information from the state as to how they act on the zone issue. We'll look and see if we've made any progress on some of the percentages in some of these communities. Hopefully we'll see them start to turn around. We're waiting for the flattening of the curve, which we did in the spring. And when it came and we saw that it wasn't growing as fast as it had been to that point, we had a little mini celebration. And I think we're waiting for the flattening of the curve on this one as well. In any event, George Latimer, Westchester County Executive, thanks for tuning in. Stay safe, and we'll see you on Thursday.